Hello guys and welcome back to my channel Malik Helps. So this is the video about hygiene and ecology. A lot of friends find this subject very boring, so I decided to include only the main things which are important from the point of view of KROK examiner. So most probably there will be nothing extra, so I'll try to explain almost all of the things, but in the video I'll keep on highlighting. If you don't want to remember each and everything, so I'll highlight the important information in the video and summarize the video well. So let's start. So the first thing which we need to know is about the index in the social medicine. So first index is common morbidity rate, which simply means the disease registered among the total population in an area. For example, there is some 100 people in my hospital, and the total population in the district, maybe for example in Kiev, is 1000 people. So the calculation of the common morbidity rate, I have provided the formula. 100 divided by 1000 into 1000 will be the calculation. Although the formula was never required, there was no question over the common morbidity rate, but in case it's important thing, so here is the common morbidity rate. Next thing, important thing, is correlation factor. Correlation factor is the relation between the phenomenon or the factor. So factor, for example, age is a factor. Phenomenon, for example, blood pressure is a phenomena. So correlation between the service record and eosinophil concentration in the block, for example, like eosinophil concentration is a phenomena and service record is a factor. So for example, age of the lactating woman, age is a factor, and the amount of milk they produce is a phenomena. So the correlation factor is the relation between the phenomena and factor. Also there are some values required. If you can remember, it's good. If you cannot remember, the values are not so important. So here are the values of the correlation coefficient, showing it as a weak, moderate or strong. I haven't seen any question over it, but the main important question which I have seen is they ask the relation between the blood pressure and the patient's age. So which parameter we need to calculate for the blood pressure and patient age? So the same way, correlation coefficient, patient age is the factor, the blood pressure is a phenomena. Another question says that during the study of pulmonary tuberculosis, the data on an socio-economic living condition and harmful habitats, so patient has to obtain. So the relation they want to ask about is between the living condition and the harmful habitats. So the same way relation will calculate the correlation coefficient. Next is a student's criteria. So a student's criteria is difference between two groups. So we often confuse with the question in the KROK questions about the student's criteria and the correlation coefficient. So I see the question is it was found that for every 100 births, women with risk factor had 30 preterm births, while women without risk factor had 5 preterm birth only. So what statistical method of data processing would be optimal for the doctor to use to estimate the validity of the difference between the groups? So it's directly asking the difference between the groups. So it's simply the calculation of the student's criterion or student's t-test, we can say. So I have included the example here. Example, the preterm birth between the group of two different women groups with risk factor or without risk factor. So this is basically the student's criteria, the difference between two comparable groups which are having similar things. And this correlation factor is simply between the relation between the phenomena and the factors. So moving ahead, next is intensive indicator and extensive indicator. So if we talk simply, the intensive indicators are the indicators which will tell about the severity of the disease. any pathology is there, any disease is there. So how much is the disease severity? So the indicators are birth rate, overall mortality, infant mortality, morbidity rate, like how many people are dying through the same or some particular pathology or some chronic disease. So this is what indicated by the intensive indicator. I have made a mnemonic as well if you want to remember. The boy is doing MD. The boy is doing MD. So BOIMD. So intensive indicator. Another definition is here, or concentration of phenomenon within a given unit of measure. Whereas the extensive indicator focuses over the cause. What's the cause of the pathology? Like the intensive indicator indicated the severity, how many people are dying through the particular disease, and the extensive indicator highlights the cause, like what was the cause behind this much of the death of the patient. Not very important, but the intensive one seems to be more important from the KROK point of view. However, they are easy to remember though. Body mass index, just remember the formula. I haven't seen any significant questions in the KROK exam, but for the body mass index, mass in kg and height in meter square. So this is how we remember. Obesity I have explained in the last video. If you haven't seen the last video, I have explained all the types of obesity in the last video, so please watch the last video as well. Now the health groups. Ukraine has divided the health groups into the 5 different groups. So in the first group, healthy children are there which are getting sick just less than 3 or equal to 3 times in 1 year. So according to Ukraine, some children who are getting sick just for 3 times in a year are categorized as in a healthy population. In the second category, the children who are there are healthy, but they are lesser resistant, so they are getting sick like more than 4 times a year, so basically having a bit lower immunity than the healthy children or the first health group. Now the third, fourth and fifth health group are more towards the severity. So in the third group, the patient suffers from the chronic disease in the compensatory stage. For example, the patients are having chronic diseases, chronic pathologies, but they are still able to do the daily routine activities, the physical activities normally. That's the third health group. In the fourth health group, there are still chronic pathologies or chronic diseases, but they are in the subcompensatory stages. For example, the people are not able to do all their physical activities, all their works. The physical activities are reduced by this stage. They can't do their all daily activities properly. They are reduced by the group fourth. In the group fifth, it's more like a palliative care group. So in the fifth group of Ukrainian category, the chronic diseases with the decompensatory stages. For example, there was some question that the glomerular filtration rate of some patient is just 5 right now, 5 ml per hour. So the patient needs to be go for hemodialysis as soon as possible. So that's the decompensatory stages. At this stage, the patient cannot do any physical activity or any daily routine at all. So this is about the health group. About the sick leaves in Ukraine. So if a person requires sick leaves for 5 to 10 days, so they will be given under the supervision of the department head. For tuberculosis in Ukraine, they are providing the holidays for 10 months. For some sort of fracture or some normal injuries, the medical leaves are for 3 to 6 days. So next, moving ahead towards the standardization. Standardization is the question which we most probably mark wrong. So let's see what it is. It eliminates the influence of qualitative or quantitative heterogeneity of an intensive indicator. Intensive indicator, we remember as just now we know the boy is doing MD. So all causes of death and all. So there is for example morbidity in different age groups. So I have taken this line directly from the KROK question itself. If you cannot understand what standardization is, then just remember this, that age structure of the population is different in each district. Like in the district Kiev, the age structure of the population is different. Like the younger people are more there, and the older people are lesser in numbers there. And for example, if we talk about Darnitsa or Lviv, so maybe there are lesser young people and more older people. So it simply states the example of age structure of population is different in each district. So the answer which have to be marked is standardization. Moving ahead, like who will provide how many holidays? So there are two portions of this. First 4 months the holidays will be provided by MAC, and after 4 months, if the holidays needs to be extended in some question, so they will be provided by MEC, MSEC or SMEC. I have given the full forms of them, all of them. So how to remember this thing? So first 4 months will be provided by MAC. So A comes before. So first 4 months the holidays are to be provided by MAC. All right. So MAC states Medical Advisory Commission. So if the holidays needs to be extended more than 4 months according to Ukrainian category, so E comes later than A. So MEC, MSEC or SMEC, I have given the full forms of them here. By reading them once, you will remember next time. Let's see the question over it. An employee has been sick for the 4 months. So who is authorized to provide the further disability examination of the patient? So socio-medical expert committee or medico-social. So after 4 months, the option which is suitable to mark is with E. So because E comes after A. So socio-medical or medico-social, whatever it is, like MEC, MSEC or SMEC. So they want to extend the holidays after 4 months. So it will be MEC or SMEC, whatever it is. Next is intensity parameter. Intensity parameter is also known as morbidity rate. So it measures the number of deaths due to any specific cause. For example, circulatory related mortality. I have taken this example from the KROK question itself. So let's see the question. In a city with the population of this per year, so there were some deaths, 5600 deaths were registered, including 3300 deaths were caused by the diseases of circulatory system, and some this much deaths were caused by neoplasm related mortality. So they are asking that what parameter will allow them to characterize the circulatory related morbidity in the city. So the intensity parameter, or also known as mortality rate, will be the factor which will measure the number of deaths due to specific cause, like for example circulatory related mortality in this question. Next is sigma deviation. Sigma deviation basically states what that we all are a group of students, and in the group of students there is a basic level of physical development and all the characters. So sigma deviation basically states that how far is someone from the basic or average development. For example, or maybe another definition I have, difference between observed value and the average value. So let's see the question, you will understand it. A 12-year-old girl was there who has height this and weight this. So it is necessary to draw this conclusion about the degree and proportionality of the girl's physical development, evaluating each parameter in isolation. So which method they need to use to evaluate if the girl is of normal development or if the girl is far away from the normal development of the children. So we are going to use sigma deviation as a method for that. Here are some effects that the question is directly asked over these effects, like this is the thing and what will be the effect of this product or this chemical on the human population. So for example, sulfur anhydride, they ask that in the atmosphere this is the sulfur anhydride concentration, so what are the effects of sulfur anhydride over some population? So we have to mark the effect joint. For the manganese, we have to mark the effect complex. If they ask about the sulfur gas effect, so the sulfur gas effect is chronic non-specific, and they ask about what kind of factor it is. Age. So age is an uncontrolled endogenous factor. Since we know that we cannot control age, it is uncontrollable, it is an endogenous factor. So another thing is about cadmium. So cadmium poisoning will lead to ittai disease. No need to know what is ittai disease, just remember that cadmium poisoning, when you are given in the question, then mark ittai disease. Let's move ahead. Some things about hygiene. So let's see what hygiene is. Hygiene is the science of preventive medicine and the preservation of the health. So some effects are there. I will tell you about all of them, but I'll highlight which is the more important for you. So synergism is the amplified combined effect, where the effect comes greater than the sum. About the antagonism is the reduced combined effect, which is lesser than the sum. Potentiation is when one chemical enhances the effect of other but has no effect on its own. For example, a catalyst in a reaction. A catalyst will increase the rate of reaction and a lot of factors, but the catalyst has no effect on his own. He will not change or any chemical proposition of the reaction. So one chemical enhances the other's effect but has no effect on its own, is potentiation. Another thing is isolated action. Chemical acts independently without interaction. 1 plus 1 equals 2. Even if we mix two chemicals, they will interact differently. Or even if we take two drugs, so those two drugs will act differently in the body, they will not have any effect. So this is isolated action. Complex action is unpredictable or mixed effects due to the chemical interaction. So let's see some question over it. The main questions which I have seen are so human body receives from the atmosphere a number of chemicals. What type of action results in the combined effect which is less than the sum of the effects? So we know that the less than the sum of effects is antagonism, right? So the question 1 is easy, where it just directly says that the combined effect is less than the sum of the isolated action. So we are going to mark antagonism for this question. And another question they have asked that potatoes become green, and what toxic substance has caused such poisoning? So that's solanine. Mark solanine for the potato poisoning. Another question states that type of joint action where the overall effect on human body is more than the sum of individual effect of each separate substances included in the concentration. So we know that when the effect is more than, so it's potentiation, right? So type of joint action which is more than the sum of individual effect is potentiation. Let's see some more questions. So another time a question has been asked, that question number 4, less than the sum. So again we know that less than the sum is antagonism. So another question is there. During the preventive medical examination of middle and high school students, doctor were determining whether the biological development of the children matches their calendar age. For this purpose, doctors were using annual increases in the body length, ossification of the hand bones, numerous permanent teeth. Additional development indicators should the doctor use or include during the examination. So it's development of secondary sexual characters. So I have seen two types of question. There is another question. So when the option is given development of secondary sexual character, you are going to mark development of secondary sexual character. If this is not given in the question, you are going to mark the vital capacity of the lungs. So there are two types of different questions. When development of secondary sexual character is not given in any of the option and they are talking about development, the physical development, so then you can go with the option vital capacity of the lungs. So about manganese, question number 6, about manganese we have talked that the effect of manganese over the population is the effect is complex. Next is pneumoconicosis. So this is the category of lung disease which is caused by the inhalation of various types of dust, primarily in the occupational settings. So some people, some worker are working in coal mines or some harsh environments where they are prone to inhale some different sort of dust. So due to this they are getting some chronic problems, because in the mild stages or in the lower time of period exposure, there will be no real effects. When the problem really become chronic, then only it will show the effect. So most of the time it happens like this. So chronic cough, the symptoms which we'll see: chronic cough which will be often dry and persistent, shortness of breath which will worsen over the time or during the time of physical exposure, chest pain, fatigue, clubbing of the fingers. Clubbing of the fingers simply means a large tip of fingers or toes in the advanced stages. Let's see one by one how many categories are there in the pneumoconicosis. So first of all, there is coal worker pneumoconicosis. So whenever there is coal, the question about coal has been asked. Also says black lung disease. It is caused by inhaling coal dust, and it leads to the progressive massive fibrosis. So black lung disease we call it just because coal's color is black, so the lungs start to get black due to it. Even the sputum turns black while spitting because of the coal deposition. So next one is anthracosis. It's also related to the coal dust inhalation. So caused by inhalation of coal dust associated with coal mining. So when they give the question about the miner is having such and such dyspnea and such symptoms related to the respiratory system, so those times we can mark the anthracosis. Next is asbestosis, which is caused by inhaling the asbesto fibers. So construction workers, asbestos miners are prone to these things. So the symptoms which we'll see is lung fibrosis, pleural disease, asbestos mining. Berylliosis is caused by inhaling the beryllium dust. So in some sort of nuclear industries, chronic granulomatous reaction in the lungs. Silicosis is caused by inhaling the silica dust, which is seen in miners, construction sites, stone cutting industries. Tuberculosis and lung infection risk. It increases the chances of lung infection. Next is siderosis. Siderosis is related to inhaling the iron dust. So a lot of things are there, but let's see an example: anthracosilicosis. So if we break down the word anthracosilicosis, so anthraco means coal and silicosis means silica dust. So if they inhale both, then the answer will be anthracosilicosis. So we have to remember in the question that how many type of dust the patient has inhaled during his occupation. So if he was working in the coal mine as well as the construction site as well, so he might inhale the coal and silica dust together. So mark carefully anthracosilicosis. Let's see some questions. So a 44-year-old is working in the coke industry. So we know what to mark: anthracosis is related to the coke. So another thing is another question is coal. Question number 2, coal extraction. In about the same thing about the coal they are talking about. So we will again mark the anthracosis. Another question, they are talking about the metal dust. So we know that metal dust, when they are asking about, so we have to mark the siderosis. And another time they are talking about an ore mine. In the question number 4, they are talking about ore mine. So ore is also related to the metal, right? We know that the ore are metallic ore, we know that the compounds are metals. So we again mark the siderosis. So a lot of things are there. If you cannot remember all of them, let's see the most important thing on which the question has been asked again and again. So for coal we remember anthracosis, for metal or ore we remember siderosis. If you cannot remember all of the things, just remember this most important. I have also provided a table to summarize all of the things in case you want to remember all of the things. not just the important one. So let's see, pneumoconicosis, as we know that they are related to the occupation. How do they define that a lung disease which is caused by the inhalation of the dust particles from the workplace or the place of occupation, the construction, mine, or any plant, any kind of plant. So the types which we know already, we have discussed most of them. Silicosis is these are the keywords directly from the KROK exam, so you are going to see such words in the question itself. So that's why I kept this table in the video. Silicosis is in the cases of porcelain factory, coal mines. Anthracosilicosis is seen in the mines, people who are working in the mines, or dust-free silica. So anthracosis, which we saw in the carbon and coke or coal industry. Siderosis we saw in the open cast ore mine or agglomeration plant. Heavy metal conicosis, which we will see in electric welders. I see some question in the crocology about the heavy metal conicosis, but not very typical for the test center. Heavy metal conicosis includes the electric welders. Bicinosis includes the flax processing. The asbestos is related to the building and constructions, roofing or drain pipes. Diagnosis, how we can do the chest x-ray is basically enough to do the diagnosis. We may see some sort of fibrosis, because these diseases are chronic. At the acute stages, nobody noticed these diseases. So after many years of inhaling such particles, the patient really feels the symptoms, and by those stages these diseases are already chronic. This is it with this video. I hope you enjoyed the video. If there are some doubts, or if you want to ask about something again, let me know in the comment section. Thank you so much. Have a good evening.